is Janay Todd, and I'm a manager of diversity and community outreach at GAP, also known as an IRI community connector, and your host today. I am so excited to be joined by an esteemed panel of Alzheimer's disease advocates. Ms. Terry Montgomery is a patient advocate living with dementia, and she's joined by her daughter, Shon Lowe, who is a caregiver and dementia advocate. Ms. Terry and Shon have multiple organizational affiliations, which I'll give them an opportunity to discuss. And then we also have Ms. Pamela Price, who's the Deputy Director at the Balm in Gilead. And lastly, I'm not sure if Sue Peshin was able to join. Sue is the CEO of the Alliance for Aging Research, and she had a family emergency today. So we have our very own president, John Dwyer, who will not be able to fill Sue's shoes, but it's a nice alternative. So thank you so much for your flexibility, John. And thank you for joining us.
Do a Sue Peshin impression.
Please don't. Please don't.
She's angry at Medicare. I can do that impression. So
that might be a really good one. Yeah.
Oh, wow.
Awesome. Well, thank you so much for joining, everyone. And we're just going to jump right in. So for everyone who may be less familiar with you or the organizations that you represent, I want to give everyone an opportunity to share a bit about either your organizational mission or your personal mission in your approach to advocacy. And I would like to start with Pamela.
Sure. First of all, again, thank you again, Janay. John knows how I feel about him and everything that he's done with GAP, everything I believe that GAP stands for and how much we need more of it. So I just want to say thank you for allowing me to be with you all today. So I am Pamela Price. I am the Deputy Director for the Balm in Gilead. We are a national nonprofit organization. We just celebrated our 37th year of work, where our mission really is to address health disparities and inequities in African American communities, but across the diaspora. And doing that through the vehicle of our faith leaders and our faith institutions, as well as really being a bridge between community partners, public health, pharma, and other stakeholders trying to get these audiences that typically don't engage with each other to come together to really think outside of the box and be practical about the solutions that we need, but making sure that our communities and the individuals that we're serving remain centered in the work that we do. So I'm really, really excited to be with you, Alex, today.
Thank you so much, Pamela. And Ms. Terry?
Come off mute, Terry. You're muted.
Forgot to do that one. Apologize. Well, it's good to be here today for this event and for the question that you asked. Basically, for me, again, my name is Theresa Terry Montgomery. I am happy to be with you guys today, and especially John Dwyer and all of you that are here, because there's so many affiliations as I am on your team, on VOA and on WTD. It can go on and on and on. But the beauty of it all is to be able to have a purpose, to be able to continue to introduce one to the other. I think that all of us are winners. I think that we really win by getting out there and rubbing arms and elbows with one another. So I'm excited to get to be here today to share and do whatever we need to do to be heard and make a difference.
Thank you for being here, Ms. Terry. And Shon?
Okay, good afternoon, everyone. I am Shon Lowe. I am the daughter of fabulous Miss Terry Montgomery, and I'm excited to be here. We have a different dynamics as far as different platforms that we are on, but I will want to talk about today the platform of GAP and the platform of WTD and my mom's podcast. I have to promote that. So basically, I want to really chime in on the different communities and adversities that we have that we challenge each and every day, as far as being getting our diagnosis out there and clinical trials, and having our people want to be within those clinical trials and being a voice and starting to speak up and speak out for our own community. Thank you.
Thank you, Shon. And last but not least, John, we got an introduction to you in the beginning, and I'm sure lots of folks know who you are as our president at the Global Alzheimer's Platform. So let me pivot a little bit and ask you, John, what is your approach to advocacy?
I will, and I mean it, when I was a little younger and had a little darker hair, I got to hang out with Congressman John Lewis from time to time. And my central view of advocacy is John Lewis's famous words, get into a little good trouble, cause a little good trouble. And I think that advocacy has to be true to the advocate. I think advocacy has to be true to a clear objective of what will make people's lives better. And I think advocacy requires us to hold politicians and policymakers accountable for the lives and well-being of everyone. And what we do is we try to represent communities that don't have as big a voice, don't have the resources to make as much noise, and we need to make good trouble on their behalf.
I love that. So Ms. Terry had mentioned Voices of Alzheimer's, and as I was prepping for our panel, I realized that everyone here, I believe, has a connection to Voices of Alzheimer's, which is a patient advocacy organization whose advocacy priority is to ensure that Medicare beneficiaries have access to FDA-approved Alzheimer's therapies. So I kind of wanted to talk about um, you all's viewpoint on working in coalition to get things done on a policy advocacy perspective. Um, so I'm going to pivot to Pamela, if you would like to tell us about the importance of working in coalition to get things done on the policy advocacy level.
Yeah, no, absolutely. So I want to again kind of paint the context, and I think John, him sharing the story in terms of kind of how he got into this space, and I think it's important for us to realize that why advocacy must be centered in the community, why it must have not just a grassroots approach, but it must be tailored to individuals, their families, then the community, and then kind of, continuing to scale up and doing that in a very intentional and a very bi-directional way. And it's because our communities are consistently stretched, be in physically stretched, with the different health diseases and health disparities that they are facing. They are continuously stretched from a mental standpoint as well, in terms of how they are managing this, how they are navigating just daily life. And then when you add on in there things such as Alzheimer's or dementia, or the gambit of other chronic diseases that these communities also are overburdened by. And then they're also overburdened with poverty. They're overburdened with the lack of education, a lack of awareness. If it's a lack, it is existing in these spaces. And advocacy has an important role to play in being able to change that. But we have to make sure that we are sitting and spending time and connecting with these individuals to know how best to advocate with them and on their behalf.
I love that. You touched on something very important about like leveraging collective resources, right? And how our communities, diverse communities, are stretched. So that supports the need for us to work together, right? I had a lovely conversation with Ms. Shon this morning about the village concept, right? Especially from a caregiving perspective in diverse communities, we're all in it together, right? There's not just one person. So I would love to hear your perspective, Shon, as a caregiver and an advocate. You're producing Miss Terry's podcast. I would love to hear a bit more about that village that you work within.
Sure, absolutely. First and foremost, I also want to talk about the advocacy component, the acts and on promoting and supporting the cause and idea of policies. With myself and my family, is not just me. You guys see me more often than everybody believe I'm the primary, perhaps caregiver, but you know what? I am one of my family caregiver, one of my mom's caregivers. And what I would like to say with that, and what I would like to, what that looked like, and to discuss, is that being a caregiver, you have to also want to be educated. You have to be educated on what to do. And a lot of times within our community, we automatically do not want to reach out. We try to take on everything ourselves. We're kind of made up like that. Okay. We do not like to ask for help, because asking for help for us, we feel defeated. And when we do that, we are exhausting ourselves. And when we exhaust ourselves, we are also not good for ourselves and a good caregiver for those whom we care for. So it's important to have that mental component with being able to take care of our mental health, physical health, when we're taking care of the person that we care and love. So I will say that, and I don't mean to bring this into just about the mental health format of it, but you have to love yourself too. And you have to find time to take care of you, to be able to be a great asset to that person of whom you're caring for. And I'm saying that because of our communities, we neglect self-care.
Yeah.
And with that, we have issues with high blood pressure, diabetes. We may be diabetic. We may be, all of these other issues. And a lot of caregivers, unfortunately, they pass away before the person that they're caring for. So we have to start in our communities, reaching out and just being, able to be that voice and say, hey, take care of you before you being able to take care of someone else. So that's important. And delegating. Learn to delegate.
Absolutely. As you were speaking, Shon, I was thinking about, when you're on the airplane and they say, put on your mask first before you help others. That I feel embodies what you're talking about. For us to be effective advocates, we have to take care of ourselves, and we can't forget that mental health component. So thank you so much for reminding us of that. John, I like to switch gears a little bit. So we kind of we're talking about taking care of ourselves, and that reminds me of like the first steps that we need to take when we're wanting to be effective advocates. Can you tell us some of your common strategies that you employ when you're wanting to first get started with an advocacy campaign?
I think if Sue is here, and I'm familiar with her playbook, she would say, you want to map, we'll just talk about the federal government for a second. And elections have consequences, so that map has changed. But at the end of the day, everyone needs to realize that Alzheimer's and dementia are equal opportunity diseases, that no matter how rich or poor you are, everybody gets it. And it doesn't matter. You can't buy your way out of this disease. And so Congress tends to be occupied by older Americans who have loved ones and family members and constituents that are ravaged by the disease the same way other communities are. So the bad news is also the good news, which is there are a lot of patients, sick patients with this disease, and there are a lot of members of Congress and senators that are very familiar with it because of that. So that's where you start first, is you got to know, everybody knows what we're about in some way or fashion. Second, you look at the leadership and ask who has already demonstrated some empathy for the journey we're all undertaking and the need to address the issues we've already heard about. And then never forget that all healthcare is local. And so while they may work in Washington, they live in fill in the blank. Phoenix, Arizona, Western Washington State, Milwaukee, Wisconsin, Nashville, Tennessee, and each one of those communities have remarkably active and important constituencies that parallel what we all care about today. And we have to be sure we can point to the local challenge, the local burden being imposed on the people that are going to vote for them, as much as the national challenge, and try and put that all together just in a coherent fashion. So we appeal to their both their political judgment as well as their empathy for this condition as we try to advocate for programs. Now, it doesn't work with everyone, but it works with a lot of folks when you talk to them about pocketbook issues and lifestyle issues and personal pain, and bring it home back to their home, where we talk about the hospitals, the churches, the senior centers that are filled with folks that are trying to give care or get care for this condition. And then you have to be realistic and not compromise, but make an ask that is in fact within their power to give. That's why I look at Theresa and Pamela, and if she was here, Sue, and remember fondly when we were out at the mall yelling about the way Medicare had first approached reimbursing for the first approved drug. If we don't do those things loud, we're not going to be able to lift all the boats. But then we got very local with the members of Congress to make sure that our position let them understand what that meant to their constituencies locally as much as our national voice did. So that's how I start.
That's great. You hit on something so important, John, which is letting folks know about who we are and leaning into that empathy and sharing our personal stories, which is a great opportunity for us to bring Ms. Terry into the conversation as someone who's living with dementia, who utilizes her platform and her voice to share widely about, her experience navigating with this disease. So, Ms. Terry, please share with us about what that looks like, any opportunities that you've had to interact with members of Congress or to use your platform through your podcast or your engagements with Voices of Alzheimer's to share your story and resonate with the members of Congress and other elected officials.
It's really good to be in a position where you're not shy and to share and to talk about personal things that people may not want to talk about. And being one of the minorities, that we have the audacity and the courage to speak up that yes, we have this, yes, we need this service, yes, you need to do this, yes, to know that who is our representatives in the states, in the counties that we live in, yes, to the place where you go to the doctor, yes, and seeing what is missing or what talents that they may have or may not have. Yes, that they know what it is to live with dementia. Have you had any training with those who have dementia or Alzheimer's? Have you been able to meet the families and how meet the family and learn to talk to the patient opposed to just talking to the family? Have you felt of what it is as to what ages of how they're much younger than what they were? I used myself just a few days ago when we were talking about something else of a diagnosis that I had. And to tell people to not get in a box that, oh my gosh, my life is over. Now it says, no, you continue to fight. You continue to remind them that what if you was 35 or 45 years old? You get something else. So you sort of talk that way to them so they can understand. So you don't get Medicare and CMS to try to end someone, put them in hospice, have them stop or whatever it is. You see how much gas is still in that person to be used, and also for what trials that they have so they can come and participate in that. So it's a whole lot that we have to speak out in the medical field. We have to speak out about being a minority, and we may not know that. But can we start a group over here, or can we start a group there? And so as you're on your journey, you have to speak up, share it. What it's about is not something to stop us in our tracks, but to stop us is to get more of what's going on, to be even diagnosed correctly, to let them be in the know of what will you do to make them be able to qualify to have certain tests so they could be more accurate on it. So when you're having those conversations with your doctors and with the places that you're going, and they see, they will look us up and find out what's going on. Just like how we're having this today, somebody's going to listen to it and say, yeah, we understood that where we are. And so we want America, the world, to understand that no matter where you are, to be able to pull people together, and those who have a short, low voice, give volume to it, that you want to live and you want to decrease what is happening within our communities. And I really thank you all, and John, for all of you having this discussion.
Thank you, Ms. Terry. I like to lean into something that you mentioned about training, and about the need to equip either healthcare practitioners or other advocates, organizations in the field with the information to be able to make the lives of dementia patients better. Pamela, I'd like to ask you a little bit about what the Balm and Gilead is doing, because I know you all provide a lot of educational training and materials. You have the Healthy Churches Conference. So I'd love for you to talk a little bit more about what you all are doing in that space.
Yeah, absolutely. So we our training and our capacity building is probably split between two audiences. So it's thinking about what is it that our community needs, right? And we're thinking about it, what do they need across this journey with Alzheimer's and dementia, or really just across this journey that we're trying to make more equitable in return, regarding their health. And then the other audience is, a lot of what Miss Terry and everyone else has kind of touched on is it's who else is touching these individuals and their families and their community. So thinking about our healthcare providers and our health systems, but also thinking about our policymakers at every level, thinking about our research and academic centers who at some point may, be involved or engaging. And what is it that those two groups need, right? So it's interesting when we do assessments or surveys that are community facing and saying, hey, here, what are your issues? What are your barriers to engaging in a clinical trial? What are your barriers to going and getting screening? What are your barriers in terms of getting the access that you need to the screenings to even determine whether or not you have Alzheimer's or dementia, or getting into that clinical trial, how you go and get that information and then be able to utilize it, right? And we can ask providers the same thing. And there's an immediate disconnect, which is why the education is so important. It's why having conversations like this is so important. Some of the clinicians make preemptive decisions, if you will, because they simply just do not know how these communities are experiencing the health disparities and inequities that they are, especially when we think about Alzheimer's and dementia. So in instances where a provider just thinks, I don't want to put another thing on this individual's plate, it is now dictating in terms of treatment plans that they may do, things that they're going to discuss, follow-up or referrals to specialists, right? And we saw that firsthand when we were doing trainings as a part of our brain health center with actual physicians and clinicians who are seeing patients, especially our primary care physicians. And that's what we heard. So it was then educating them, kind of from a cultural lens, and to say, hey, this is important. These communities can't afford, especially now with new therapies coming down the pike and actually already in the pipeline, we cannot continue to afford them to be diagnosed late, because now all of this amazing innovation that we've had in the space of treatments and new drugs are of no benefit. So we have to make sure that providers are, we're helping them connect the dots at the same time that we're helping our communities help connect the dots. We're helping and equipping our churches with how does policy and advocacy look like for your church or for your health ministry and for your congregation? Is that you guys writing a letter? Is that you supporting a letter perhaps that we wrote that we're going to submit to CMS or the FDA or to Congress? How do we, instruct them? It was interesting in this past election, just instructing people on the legislative process. We're talking about communities that a lot of them skipped the, schoolhouse rock. I'm just a bill on cap, like we've had to literally go back to the studs and say, no, let's revisit. This is how bills are made. And this is why advocacy, this is why policy matters to you at every level. And that is an instrument that is meant to be your power, not someone else's. So I think that's what we have to make sure that we are hammering home when we talk about, these two groups of people and what each of them needs to know collectively to be able to change the narratives and to, reduce the disparities and inequities that we are seeing.
Oh, that was a lot, Pamela. That was on point too, regarding just underscoring the importance of education, right? Not only to the advocates, but to the community at large. So that makes me think about like our messaging, right? When we have a priority that we're advocating for, how does your message change depending on the stakeholder? I like to pivot to you, John. Um, I'm sure you have different talking points when you're engaging with healthcare providers as opposed to members of Congress, as opposed to, advocates who you work in coalition with. So how do you adapt that messaging?
Yeah, so two things come to mind. First, what you're going to internalize. And I look at my colleagues on this panel and say, you know, elections have consequences, but just because we're in some respects, might feel like we're in a minority position now. Well, I think most of my colleagues have been in a minority position in all their life, so it's business as usual. Little less common for me, to be honest. But we gotta be feisty. We cannot reduce our energy. We cannot be apologetic. We got to go right back at them. Get off the mat, because this is not a disease that is partisan. And we have to demonstrate to the current government and the state houses that we are advocating for solutions that lift everybody up. And so they have to have that understanding. But the other side of this is we have to get a little bit more disciplined, maybe a lot more disciplined about making clear what the cost of not doing something is to the health system, to state and budgets, to the federal budget, because they're going to be a different group of decision makers, and they know Medicare is close to going insolvent. They know the personal economic cost of this disease on each and every family that has it, and we need to turn those economics into good politics. One clear example, Janay, and one that we're already pushing, but we'll be doing more of it, is this current decision by Medicare to reimburse the blood tests at $17 rather than $130. I mean, if you want to talk about crazy economics, that's a classic example where they take blood tests that are super uh, new steps towards treatment, very sensitive and specific, and buttonhole them at $17 when you cannot possibly afford to give that test at $17, and force them to go up to PET tests or MRIs that are hundreds and thousands of dollars. Makes no sense, and you can't get them. It's not just the poor communities or the remote communities that can't get PET. It's profoundly difficult to get it in almost the entire country for the number of people that might need it. So blood tests are key. Get the pricing up there, win that battle, move to the next. And we're going to have to be very milestone driven in the next few years, because we're not going to get a lot. So we got to be sure we prioritize what it is we want.
Wonderful. So I know that we had a little bit delay in getting started, so we have a little less time for Q&A, but I did want to make sure that I gave everyone an opportunity to ask any questions of our panelists. Again, thank you all for joining, and thank you to our esteemed panel for providing such a rich discussion. We talked about a lot in regards to education and training, identifying who the stakeholders are, um, leveraging our collective voices, um, and knowing who the targets are, right? And leaning into the empathy that they may or may not have. But I think about what's in it for me, right? So when you identify who the stakeholders are, you need to do your research, right? And hit on those points to get your advocacy agenda across. So I just wanted to provide that brief overview of all the wonderful points that you all made, and again, to open it up for questions to our panelists. Feel free to put anything in the chat or come off mute if you have any questions or comments.
I don't have a question, but I do want to help. Pamela, let's make a plug for Healthy Churches 2030. I think one of the wonderful things about Healthy Churches 2030, if you're not familiar with it, it's a wonderful conference, but Black health advocacy is a part of the conference, among other things. So if you are available, will you just share a little snippet about what's to come? I think next week, right?
Sure. Yeah. Next week. And then, yeah, I'm literally hopping up as we speak, but I want to thank you, Mia, for allowing us. First of all, thank you, John, and the entire GAP team for allowing me to be with you guys today. These are important conversations, are so important to our communities. So Healthy Churches 2030, this is our 11th year. It is virtual again this year. We kick off next Monday. We go from Monday to Wednesday this year from 10 to 4. So a little bit shorter window with replays happening in the evenings. If you want to participate, because registration is closed, I would just encourage you that if you really want to be a part of this, to just shoot me or to shoot the GAP team an email and let me know. And I'm happy to do my best to work with our conference team to get you guys put in on the back end so that you can come and participate with us starting on Monday. So thank you so much again, Mia, for giving me that opportunity. And thank y'all. I'm so sorry that, yeah, I've got to kind of, rush. But I really, really appreciate it. And I know I'm sure we'll be able to connect and be with each other again. Thank you guys so much.
Thank
Thank you
you.
so much,
Thank
Pamela.
you.
Safe travels, and thanks for
Thank
joining us. And with that, I want to just give our remaining panelists an opportunity before we end to share any closing remarks that you would like to share. If you want to, give advice for others who are pursuing some advocacy initiatives, or just to share about what you have coming up. And I'll start with you, Ms. Terry.
Well, as far as what's coming up is to keep people involved as far as knowing about the latest. First is getting tested because we're ignoring that. And that's number one, that we're hoping that people will do. Whatever symptoms you may have, go check it out right away and then worry about what it is later. But first, we need our community to get engaged, get involved. And the last thing is that with that, I leave with all of them, all of us, is just remember Haya, how important you are. You have no time or no need to overlook yourself.
Love that. Would you like to share anything, Shon, and then John?
Okay, I would like to share that as Mr. Dwyer was talking about the test, which is absolutely ludicrous, that they are not willing to spend the amount of money to cover this. It's just absolutely ridiculous, in my opinion. So I would love to just do a campaign and start a campaign with our voices. And if you would like to be speaking on the show, on my mom's show, TW LTD, Walk and Talk of Dementia, would be great. A platform to get our voices heard, and to just have everyone jump on board with this, because it's thousands and thousands of dollars for a MRI PET scan, and you're talking about $130 that they're not willing to cover. This, to me, speak volumes. So if you want to talk about crazy policies, that right there should be something that we should take a deep look into and just say, Congress, no more. This is nuts. And CMS, I'm sorry.
Sign me up, Shon. I'll come on your podcast and give them heck.
Thank you so much. I love that. Thank you. Thank you so much.
Awesome. Okay, well, I know we're at time and we have a packed agenda today. So thank you all so much for joining us for this dynamic panel. And I look forward to seeing you in the next one. Have a good rest of your day.
Thank you.